Well, I'm Hjördis Foy, and I was born in Karlsson and Manbeck. I'm from Sweden, and I happened to marry an American who was in Korea, where I was too. After the Korean War, I was there as a physician with the Swedish Red Cross, and we came to United States, and he became a teacher, high school teacher, after retiring from the military. And thus we ended up in Seattle, and I was looking for something to do with 3 small children. And the offer I had was a fellowship in what was then the Department of Preventive Medicine. I had a background in infectious diseases. I had done a little bit of research in the infectious disease hospital in Stockholm, so it fit me rather well. I didn't quite realize that I was supposed to be a student at the same time, so there were courses given in the department, and I gladly sat through them, and suddenly I had another degree. And then I also got a PhD because I did research, and I was lucky. The research was rather successful. It was in acute respiratory diseases with emphasis on mycoplasmal infection. We described the epidemiology of mycoplasmal infection, mycoplasma pneumonia, and milder infections in civilian populations. They had previously been studied primarily in the military. And it was a relatively new bug in that it hadn't been discovered until the last decade or something like that. So suddenly I had a PhD, and then I was on the faculty because I kind of was stuck in Seattle. And I enjoyed being on the faculty, and I continued the research in acute respiratory diseases, panned out a little bit into the genital tract and obstetrics, and we did studies of influenza efficacy during the 2 influenza epidemics. The first one was a Hong Kong one, and the second one was a so-called swine epidemic. That wasn't much of an epidemic, just a great stir-up. We did efficacy studies of the vaccines. And I guess that summarizes what I did in research. Also taught a little bit. Taught epidemiology courses, taught infectious disease courses, was involved in seminars. Those are the high points. Well, Tom Greystone was a great leader. He kept us together, and of course he's more or less the father of the school. As we became a school, there were 4 departmental chairs, and we became more divided. So in a way it was a little more difficult to carry out your research, because my research was in between epidemiology, where I was, and the laboratories that were in pathobiology. And each department wanted to be itself, more or less. And dividing your research between 2 was a little more difficult for a junior faculty member. It wouldn't have been difficult for a senior faculty member. And also, we knew people in the other what became departments better before. And there was a certain amount of isolation after departmentalization, which I really didn't like. Facilities, of course, is a sad story. That's one of the contributing factors that we got split up. The building wasn't sufficient. People were all over the place and outside the campus even. And there were problems. For instance, my influenza vaccine studies couldn't continue because we couldn't see patients any longer. So they came to a stop because of lack of facilities. I mean, you can't, if you can't see patients or give injections properly, you can't continue with that type of study. In that respect, it was bad to get away from the School of Medicine, because they would have had the facilities to do things like that. So some of my research was really hampered by the split up into School of Public Health. John Fox, of course, had a great background in family infections, infectious diseases, polio and everything. And he died back in 1987. In the beginning, I didn't have much to do with him, but he certainly was one of the major investigators in the department and the school. And as I think back, when we became a school, he did an awful lot of the work of writing together background to become a school, fill out a lot of forms and put it all together. So the school owes him a thanks for doing that. I was around and saw what was going on in his office at the time. George Kenney, without George Kenney, I couldn't have carried out my research. Everything was done in his lab, and it's the whole epidemiology. We both shared the success of that research. Now, another person, as you're talking about my research, is departed. George Kenney had a lab tech, Gladys Kaiser, and she was pretty old. And if you talk about success of research, if she hadn't been as fantastic a lab tech and so precise, I don't think we had succeeded either. And lab techs rarely get good thanks. Well, I think the most outstanding department was biostatistics. And I guess Ed Perrin and Donovan Thompson were great leaders in those departments. But I didn't have that much contact with them, but they really have had a lot of great people in biostatistics. Eddie Cromwell. Environmental health was a little late coming up, that the leadership improved there too, and they made their marks in all areas.
I saw a picture of you. It was as part of a group picture. I think it was from the late 60s, and I believe you were one of 2 women in the Department of Preventive Medicine.
Yeah, when you work in research like that, when you work with others, you don't think of yourself as being female all the time. You just feel that you're another researcher, another worker, or whatever. But it's true that it's always a problem in promotions and so forth to be a woman, particularly if you are from outside the United States. It certainly is a struggle. And certainly there was a struggle, but I did have the support of my superiors, so it worked out eventually. Well, I'm just amazed at the success the school has made and the mark overall on public health in the United States. It's amazing.
And not just the United States, but now, especially with the new Department of Global Health, did any of your research involve work overseas?
I've been on sabbatical in Thailand. But my work in Thailand had very little to do with the Department of Epidemiology. So that was completely outside the department.
What kind of work was that?
I was consultant to the field epidemiology training program at the Ministry of Public Health in Thailand, in Bangkok. I'm going back there again as a consultant. We had outbreaks of dengue fever, especially. I knew nothing about dengue fever until I got to Thailand, and I learned, and we published on hemorrhagic dengue fever. We had small outbreaks of influenza. We had arsenic poisoning. We had anthrax from cattle and to cattle keepers. Whatever came up. And cholera. Of course, the Thais will not call it cholera. They call it severe diarrhea because it can't be known outside the country that they indeed have cholera a little now and then. But they publish on cholera regardless. So it's a lot of fun.
Well, I think the next stage that we'd like to do is ask you a little bit about your personal interests and passions. I know that you paint, and we wonder if you could show us some of your paintings.
I'll be glad to do that.
Good. How long have you been painting?
I did that before I started medical school, or a little bit, very little. So I always had interest, but you couldn't do it through medical school, and you couldn't do it with 3 kids and a job, so then I took it up again.
And this painting here, you say, is about global warming fantasy?
I'm going to add something to that. You want to put, I think you're better at putting things over there. George Kenny has one of mine on that, also global warming. Another one.
So, did you build this house here?
We had it built, yeah.
Yes.
I did.